Imagine this, a busy hospital waiting room full of people with different levels of care that need to be addressed. Some of these patients may be experiencing a life or death situation, long-term illness, or an acute infection. As a nurse, you must be able to triage and communicate effectively with each patient to ensure quality care and that all the patient's needs are taken care of in a timely and professional manner. Today I will be addressing how to communicate effectively as a caring nurse and explain techniques to ensure this. Although you may not work in the medical field, you are all patients who are in and out of doctors' offices and communicate with healthcare providers at each visit. Knowing the ins and outs of nursing communication can help you better understand what the nurse is trying to establish with you as a patient and help you achieve your desired goals. I will explain some basic principles of communication in the hospital setting, including time and voice management, active listening skills, and interpersonal communication. To communicate effectively as a nurse, you must work together with the patient, develop trust, and address treatment goals. According to Peplow's interpersonal relations theory, there are 4 stages of the relationship that achieve a common goal. First is the orientation phase, where the nurse engages in patient's treatment and helps the patient develop trust, as first impressions are important as a nurse. During the identification phase, patient and nurse work together, and the patient interacts and becomes a participant in the patient treatment goals. In the exploitation phase, patient takes advantage of all services offered to address treatment goals. And lastly, the resolution phase. As a result of effective communication, patient needs are met and he or she moves towards independence and the relationship ends. According to the article, Effective Skills for the Caring Nurse on the Pearson Learning website, employing active listening skills and voice management are key concepts in effective communication with the patient. The article emphasizes the importance of using active listening skills to ensure a successful interaction through techniques that facilitate discussion. Example, leaning slightly forward and using sounds of encouragement. This demonstrates that the nurse is truly listening and assimilating information provided by the patient in order to arrive at an eventual nursing diagnosis. Voice management not only refers to accurate enunciation essential in ensuring safe practice, but also relates to appropriate pitch and intonation, which helps towards establishing and maintaining rapport with the patient. If a nurse's tone of voice fails to match the lexical input, then effort to employ the correct phrase to reassure or empathize with the patient are wasted. On the U.S. National Library of Medicine National Institutes of Health, an article titled Communication in Nursing Practice emphasizes the importance that the patient needs time to express concern and have the nurse's undivided attention. A key element is the need for a peaceful environment with no external distractions, which will ensure appropriate confidentiality of the dialogue. Frequently, we see the phenomenon of establishing and maintaining rapport with the patient. If a nurse's tone of voice fails to match the lexical input, then the effort to employ the correct phrase to reassure or empathize with the patient are wasted. On the U.S. National Library of Medicine National Institute of Health, an article titled Communication in Nursing Practice emphasizes the importance that the patient needs time to express concern and have the nurse's undivided attention. A key element is the need for a peaceful environment with no external distractions, which will ensure appropriate confidentiality of the dialogue. Frequently, we see the phenomenon of serious discussions taking place in the middle of the corridor of the outpatient department or the nursing department, clinic, or in some office of the hospital in which third parties unrelated to the care of the individual patient are coming in and out. The patient should have the feeling that the time, whether it is 5 minutes or an hour, is entirely his or hers. The patient who has the undivided attention of the nurse reveals his problem sooner, with the satisfaction that the nurse has listened and observed him or her. Mean telling your patient that you know what he or she is going to say. Just listen and demonstrate respect for their thoughts. Leave your own personal beliefs at the door. Listening means giving your time to someone else and giving full attention. Do not let your mind wander to your own personal concerns, nor look around the room. Stay focused, says Quinnet. Listening means sharing the burden of your patient's pain and acknowledging their pain. Your body language says a lot. Pay attention to holding eye contact for a comfortable period of time while your patient is speaking to you, unless this is inappropriate in your culture. Use gestures like nodding your head to show that you are paying attention. Let him or her offer a solution. Listening means paying close attention while your patient devises a solution to his or her problem, particularly when the person is severely depressed or even suicidal. Their solution is the only one that has a real chance of working, says Quinnet. Avoid confrontation. Never be confrontational and do not argue. You are there to hear what your patient needs to have heard, and your own opinions are not necessary. In a spoken message, 55% of the meaning is translated non-verbally, 38% is indicated by the tone of voice, while only 7% is conveyed by the words used, according to Moravan, the author of Silent Messages, Implicit Communication of Emotions and Attitude. An example of nonverbal communication with a patient would be to reach out and touch their shoulder to confront them in a time of anxiety or a difficult medical situation. Lastly, let's talk about interpersonal communication. Interpersonal communication is the process by which people exchange information, feelings, and meaning through verbal and nonverbal messages, and it is face-to-face communication. Some consequences of ineffective interpersonal communication can be chaos, confusion, disorder, fear, conflict, inefficient systems, and wasted resources. Poor team communication has been cited as the #1 cause of unnecessary patient deaths related to medical error since the 1990s, according to the Institute of Medicine. As each person seeks to meet his or her human needs, a number of variables, both internal and external, can combine to support effective or ineffective interpersonal communication. Large organizations, hospital units, and work groups and families run best with a cooperative spirit among the individuals. Widening your perceptions and awareness of those around you and the environment help to cultivate this atmosphere. And speaking and presenting yourself in a professional manner at all times is crucial to establish credibility. Today I have discussed some basic principles of effective communication in the nursing field: time and voice management, active listening, and interpersonal communication. The next time you go into a busy waiting room, you will be more understanding of the goals and communication techniques used by the nurse and other healthcare professionals. You can use these skills to work together in achieving your goals and outcomes. Having to go to a doctor's office can be a stressful event for some people, but being able to identify and create healthy communication with the healthcare professionals will ensure precise goals and treatment options to help achieve patient satisfaction.